Up to 100,000 newborn babies in England are to be screened for dozens of genetic conditions. The sequencing of each child's whole genome usually involves taking blood from the umbilical cord soon after birth. The work has already started with 500 babies at 13 hospitals around the country. Dr. Sarah Bowdin is the medical director of the East Genomic Laboratory Hub, which is based at the world-famous Addenbrooke's Hospital in Cambridge, and she explained to me the scope of this study.
The project is a newborn screening programme which aims to look for over 200 rare conditions and ultra rare conditions that can affect very few babies in the UK, but when it does affect them, it can have devastating impacts on that baby and child's health, and often it can impact the longevity of that child as well.
At this stage, it's a study, isn't it? But how quickly do you hope it could actually be used clinically?
So I think the answer to that very much depends on what the outcome of the study, whether the study shows that there are more benefits of whole genome sequencing for screening than there are risks. Not only does it have to be beneficial to the babies, but it also has to be acceptable to parents. And we have to be able to deal with the output of this in the NHS in an equitable way as well. So in an ideal world, if it was really beneficial, the NHS would be able to adopt this technology in the next sort of 3 to 5 years' time for the benefit of newborn screening.
The numbers are large, aren't they? Is there anything on this scale being attempted yet anywhere else in the world?
Yes, there is actually. So in the United States, there's a project called the Baby Seek Project that's been going for a number of years. And there's about to be another project started to sequence 100,000 babies called the Guardian Project as well in the USA. And in France next year, they're starting a similar project. I'm not sure of the numbers in France, but they are launching in 2025 to look at whole genome sequencing in the newborn population.
There's a big push in the UK, as there is in other countries, to find ways of delivering more effective healthcare, more preventative healthcare. In some ways because it's cheaper, but also more importantly because it prevents people going through the agonies of some of these conditions and indeed having their lives shortened in some cases. Do you hold out hopes for this as a kind of shift in the way we treat health conditions, more about prevention than about treatment?
Absolutely. I mean, I think you can already see that when we're applying this technology already on a clinical basis in the NHS. We're often doing it for babies in neonatal intensive care units where they've already presented with some severe disorders, for example, severe epilepsy conditions, unable to breathe, for example. And so we're diagnosing babies at a very young age with conditions that may or may not be treatable already. But if we can actually predict those babies that will go on to develop conditions that are currently only treatable before they actually develop symptoms, then we'll actually be able to give them the treatments before they start to become symptomatic. And in that respect, we'll only see the benefits of this once we start to prevent the symptoms from occurring. And I think we'll be preventing many, many thousands of children from going through diagnostic odysseys that can take years. And sometimes at that point, the condition is no longer treatable and potentially is fatal. So I do hold out a huge amount of hope for this technology.
Dr. Sarah Bowdin from the East Genomic Laboratory Hub at Addenbrooke's Hospital in England, talking to NewsHour on the BBC World Service.